You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey there, it's Dr. Justin. Welcome back to Beyond Wellness Radio. We got my good friend here, Aaron Alexander. Aaron, I saw you just a few months ago over at Paleo FX. It was great seeing you in person again. How you doing?
I'm doing super, man. How are you doing?
Doing great. Can't complain. It was just your birthday like a week and a half ago, so happy belated birthday.
Thank you, brother. Appreciate it.
Very cool. So what's new in your neck of the woods? I know we talked last time, you did a demo over at Paleo FX, and you were doing a lot of stuff with movement-based stuff. I want to talk a little bit more about kind of what you're doing with your clients and what are you seeing in your practice? Because you're actually one of these people out there that blogs and does videos, but you're actually clinically rolling up the sleeves and getting in there with your patients. So what are you doing? What are you seeing?
Well, first of all, thanks for having me on. I always love getting to chat with you. And but what I'm seeing with people, the main thing is a lot of consistent patterns, which is interesting. You know, and this is something that I know everybody's talking about. You know, but like modernity is folding us forward into this medial rotation, protraction, head forward, hyperkyphot, all these anatomical terminology for it's depressing us. You know, it's folding our society into this position of literal depression. You can say that from an anatomical perspective or just more like an emotional perspective. But I think that there's a balance between that. And what I am witnessing is people that are stuck in these positions, being hunched over a computer or hunched over in a bus or in their bucket seats in their cars, or whatever it is. It's affecting the way people are feeling. And then we end up responding with seeking out some type of pharmaceutical answer, you know, and medicalizing every aspect of like what it means to just feel the way you feel in the day. And then going out, seeking some placebo or some type of pharmaceutical drug to solve these problems that maybe we could potentially knock on the other end, which is our physical structure might be causing these feelings of general downness. You know, and so that's been the big thing that I've been dancing with folks in general is this feeling of like, you know, I have this shoulder thing, I have this hip thing, I have this knee thing, and generally my energy is not real great, you know, and then you look at them and from like a body language perspective, you're like, of course, you know, how could you expect to feel great when you're collapsing at the knee, collapsing at the hip, collapsing at the spine, whatever it is. And that's kind of the thing that I'm the most inspired by right now is those connections there.
Got it. How many patients are you seeing a day?
4 generally in a day, so not a ton.
And you're working longer, like hour and a half sessions.
Sir. Yeah, so I have 75 minutes with people, which is wonderful because we can talk and we can hang out and we can come in and we can kind of, you know, do the dog thing and smell each other out and kind of feel what makes sense, as opposed to just jumping in and saying, diagnose, I got 6 minutes. Okay, here's the thing. Like, it doesn't even matter what else is going on. We got to find a diagnosis and we got to prescribe and we got to work this. Instead, we can kind of dance in other realms, which I greatly appreciate.
That's great. And I know you talked a lot about posture, and I work with a lot of patients with gut issues and hormone issues. And it's interesting because Amy Cuddy did a study over at Harvard, and you're probably familiar with the study on different poses. And one of the things she had was the power pose, which is like hands on the hips, or I think the Wonder Woman pose, so to speak. Right. And then also the hands up in the air, reaching up, kind of like Rocky coming up to the top of the steps in Philadelphia there. Sure. And those different poses improved anabolic hormones, whether it was testosterone in men, and also decreased cortisol as well, which is a stress hormone. So posture, like you can actually manipulate in a good way someone's hormones by just getting them standing and sitting and moving better. So if people think like, you know, we get this major split between like physical medicine and then like metabolic or hormonal medicine, really they are blended 100%.
Right. Yeah, absolutely. And then going even beyond that, now it's finally, and I so greatly appreciate that TED Talk and, you know, Amy's books and all that. Yeah. And it's finally coming to the forefront that, wow, our movement affects the way that we feel. You know, and so standing, if you look at blind people or anybody, when they win the same way, hands up, they're excited, right? And when you do that, you open up the spine, you open up the pericardium, the heart, and all the organ tissue, open up the brachial plexus. You know, putting our hands up over our head is something that most people literally don't do in our culture. Yeah. You know, unless you're a gymnast or a rock climber or, you know, have some bleach in like a high cabinet or something, we just don't do it. You know, and that is an archetypal position of success, of winning, you know, and that's the conversion of that is your body reading those patterns as, all right, cool, Dr. Justin's doing good. Right. Let's boost them up with some serotonin or dopamine or, you know, reduce the cortisol or increase the testosterone, whatever it is. It's all different languages, different vernacular to explain the same thing that's happening. It's just different dogmas explaining different things.
Love it.
Does that make sense?
100%. So I'm a new patient. I'm walking in. Let's say I have back pain or shoulder pain. Like, what's the initial encounter like? So you're doing a workup? Yeah. Are you doing a full physical exam? Do you do kinesiological testing, seeing where muscles are turned on or turned off? Do you do different like plumb line things to look at posture assessment? What does that look like? I'm a new patient. Walk me through it.
First thing, we come in and figure out why you're here. Usually by the time you make it to somebody like me, you know, does structural integration or, you know, the Rolf technique or things like that. It's like you've been to a lot of people, you know, and you've heard like, oh, maybe that Rolfing thing, I've heard that's pretty effective, you know, and it's like by the time people get here, they've been through the gauntlet. And so it's getting an understanding of what's going on, you know, and so the first things first is kind of just talking and kind of uncovering that why of what's going on here. Beyond that, the most important thing is watching people walk in, you know, and that's something that a lot of, I think, you know, doctors or any practitioners in general may miss. The good ones don't. You know, when you're seeing the most genuine expression of that person is before they come in and say, okay, here's what's going on. It's when they first walk in and you can see that body language and you can kind of see how they walked in from the car. That's when the session really starts for me. And then as we start to go, we go for a walk, and I have a nice long office, which you're in right now, as you can see. Yeah. You know, and so we go for a walk and we watch what's their gait patterns. You know, are they stuck up in the hip? Are they pronated in the foot? Are they not able to get any range of motion through the shoulder girdles? You know, and so we just start slowly parsing out these parts of the body and seeing what parts are really lagging here. You know, because the body's going to be limited by whatever the greatest lag is. Mm-hmm. So if I stub my big toe, all of a sudden I'm limping, which means I can't get hip extension. If I can't get hip extension, I'm not going to get that rotation through the spine. I'm not going to get that same extension through the shoulder. And now my whole body is frozen up to the degree of that original restriction. So it's really just like peeling onion layers back. And then as we're going, I'm always really curious about how they think and how they feel and what's going on in their life, because I know that affects their physical structure. And that's, you know, an interesting question to ask.
Got it. So when you treat someone, are you treating them every day? Is this an every kind of 2 or 3 times a week kind of thing? What's the typical treatment protocol when someone comes in?
I like weekly. You know, weekly, it's kind of like we're on the same bus and, you know, we know where we're going. And when you have that like 2 months in between, I'm like, what was your name? You got that spine thing? What's happening? You know, but when we set up a goal That's the big thing, and so much of the work that we do as any practitioner is placebo. I know, like the secret's out. The more that someone believes that you are the shaman healer, you are the doctor healer, you are the fill in the blank healer, the more their own healing potentials, the greater they become.
Right.
And so if we come in and we say, okay, here's why we're here, here's what we're doing, here's how we're going to get there. I believe this can happen.
Right.
If you can get into that point, then all of a sudden, wow, we're activating all of the client patient's own healing mechanisms. And then all the other stuff comes in that's really helpful, like the herbs and the movement and all that. But if we can get the client/patient to believe, that's a really big deal. But that's kind of like a gray area for a lot of people because it's hard to pin that down.
Right.
I'm curious your opinion on that, actually.
Well, yeah, I think belief is really important. I think a lot of people that have seen people like me and you, I was doing a lot of physical work for many years in my office in California, and you never saw these people first, right? They'd always typically had seen a conventional physician many times. Maybe they went through the whole cortisol, or the whole cortisone, prednisone injection kind of thing to help reduce inflammation. Maybe they were on chronic NSAIDs and other anti-inflammatory meds that kind of ripped up their gut and their liver. So then you're kind of getting this person in who's more broken than they were when they originally had this issue maybe years back. So you always wish you could get them on the forefront, but getting them to really understand, like, I'm a big fan of like, what's the mechanism? Why are you feeling this way? So let's drive it back to diet. Let's drive it back to lifestyle. Let's drive it back to how you sit all day, how you move, the so-called stinking thinking, all these different things, and really have a holistic approach. And I think you do that very similar to what I was doing when I was doing more of the physical work in clinic as well.
Yeah. Have you ever heard of the chambermaid study done by Ellen Langer back in the, I think, 70s or maybe early 80s?
I have not. Please share.
Oh, it's so cool. So I just had Ellen on the podcast recently, and so I've like all savvy in all of her studies now. But she, the chambermaid study was, she took two different groups of people. They were both chambermaids, so they were cleaning up chambers.
Yeah.
They're cleaning up, whatever rooms. And what they found was with the one group, what they did is they educated them upon, okay, do you realize that as you're working throughout the day, you are exercising, man. You are burning calories, and you're bent over, and you're doing deadlifts, and you're reaching up, and you're getting all this shoulder flexion. Like, you are working it out, girl. Like, this, you were killing it. And then the other group, they didn't really give them that information. And what they ended up doing is they ended up taking, some various different, I forget exactly what they were. It was like measuring blood pressure and measuring hormones and this and that. And what they found through that was the group that was told that they were exercising and moving and doing something good, every indicator of health ended up going up. They ended up losing body fat. They ended up burning more calories. It's very interesting, again, when you start getting into that mindfulness component of how I move throughout the day, move throughout the world, how much that actually affects. Again, I think this comes back to the placebo effect, activating your own healing potential. When you are moving through the world with intention and believing, I can do it, it makes a really big change. It's instilling those practices into, how do I get out of my car? How do I get in my car? How do I chop my vegetables? How do I go for a walk? What's every step? Did I nail every step of my walk? Or did I just kind of aimlessly, mindlessly move through the day and then, ate a big burrito before I went to bed and fell asleep and did it all over again? It's just tapping into those little subtle things I think can make a really big difference. That was kind of a sidetrack. I apologize for that.
No, I think it's really important to have power and purpose, right? I think it's important that you're mindful and you know what you're doing, and again, you feel a sense of satisfaction for it and through it. Makes a lot of sense. And also, you talk about the whole purpose thing, right? Purposefully moving. I imagine a lot of the movements that you're doing, you give a lot of your patients self-care too at home, correct?
Absolutely. Yeah.
Now, imagine a lot of the movements probably have a direct carryover into what they're doing every day in their daily life. Like yesterday, I was with my wife. We were working out, and we were doing like one-legged deadlifts with rows, and we were doing these movements. And I was just talking to my wife saying, hey, imagine like pulling the groceries out of the backseat of the car with this turn and twist and bend. It's like we're choosing movements in the gym or, in the clinic that have a direct carryover to our life. So when you work out, it's like you're not just working out to get these muscles bigger so you look good naked, frankly. You want to have that carryover so you can do silly things like getting the groceries or picking your kids up and putting them in their car seat. You want to have that task be easier.
Right. And that's, the truth be told, like I that's high up on my agenda list, is to look damn good naked. And that's the important thing, is that when you go through these full, sometimes a little bit maybe more abstract movement practices like dance, imagine that. You start getting into all these nooks and crannies of your joints and your musculature that you may have been moving in the gym, doing your bicep curls, doing your tricep kickback extension, whatever's, and you're still sedentary because you're not exploring the full movement potential of your body. And so it's recognizing that it's not about the 45 minutes of actually doing the exercise a day. It's how did you enter into that exercise? How did you exit out of that exercise, and what happened in between? And you can look at this from like a musical perspective. It's like looking for the music between the music. It's not just the like, wow, cool, that was a great sound. How was the transition to the ooh, ee? That is the same thing throughout our movement experience. If you have a big clunky movement when you're sitting down or getting up out of a chair, that's that was how that sounded. Right? So it's figuring out, how do we integrate the sound of movement, and just as a metaphor, into our daily practice so that you are always singing a beautiful song with your body, right? There's a quote by somebody, I don't know who this was, but life should be a work of art because anything else would be tragic. And I couldn't agree more, but having that vision for, I want mastery,
Absolutely.
That's okay. I don't need to just accept normalcy. I don't need to just fit in. I can go bigger than that, right? I want to master this thing. I'm never going to, but I think that goal is important.
Yeah. That makes sense. And it's so funny because you're so animated as you talk. So everyone's got to listen to this interview and watch the YouTube version so they can get the in-depth personal perspective. Plus, you give David Hasselhoff a run for your money. You show that massive amount of chest hair popping out in your shirt. And I couldn't believe it. You do it in real life too. And I met you. It's great, man.
I just want to keep it loose, man. I like loose clothing. And that's another thing that's interesting, is thinking about the looseness of your clothing. If you're wearing clothing that's restricting your physical movement, then you're paying $100 to restrict the range of motion in your hips. If you can't do a full third world squat, aka a human squat, in your pants, they're trash. Like, there's no reason to volunteer to restrict yourself and put yourself inside of that box. And I feel the same way with any type of clothes. Same interesting thing as well, like thinking about the colors of clothing that you wear. There's a reason that we wear everything that we do. There's a reason we say everything we do. There's a reason we listen to the music that we do. So just tapping into those subtle aspects of yourself, because I think sometimes the work of, making your body, getting yourself out of pain, whether it be physical or emotional, whatever it is. Sometimes we get so wrapped up in the mountain, Mount Everest, we got to climb the mountain and get the pain and get it. Yeah. Sometimes, what if you reorganized your wardrobe a little bit? What if you felt more confident as you walked around the world because you really like your clothes? What if you felt more confident as you walked into your house because you organized the way things are in there? You opened up space. Every time that activates a certain feeling inside of yourself that you take into your work, you take into your relationships. All of a sudden, cortisol and all the stress hormones start reducing a little bit because you feel better about yourself. We try to tackle these big mountains because they're more obvious, but sometimes some of those roundabout, more subtle objectives can start pulling the strings a little bit, so that all of a sudden we get to the mountaintop, but we didn't even realize that we climbed it.
Right. And how do you start, because you're hitting things from a lot of different perspectives here. So how do you intermingle some of the dietary shifts and changes? Honestly, with your patients?
Honestly, I try to not be jack of all trades. So nutrition is something that if people ask me, then I have opinions, and the opinion is it should be natural. It should come out of the ground. If it's if it's not processed, if it doesn't have any artificial anything, your body probably does an okay job with it. And then I'm more into higher fat and lower carbohydrate and all that. Just because for me it makes me feel more mentally clear. But I'm am not an expert in that realm in any way,
But you look at a lot of like inflammatory things in people, because we know inflammation drives maybe cortisol and tissue breakdowns. Are you looking at inflammatory things that are maybe present in their diet, grains and such?
Yeah, no, absolutely. And that's one of those things, again, because I have 75 minutes with people in a one-on-one session.
Yeah.
We end up becoming kind of friends in a way.
Yeah.
You're still maintaining, the relationship, practitioner and client, but we could talk about anything, and that's one of the big things. Sleep is the main thing. And I'll ask that almost immediately, like, how's your sleep? Because if you're not able to repair your physical tissue as you're sleeping, then good luck with anything else. What are we doing here? And then from there, again, are you eating simple processed sugar? Are you eating, anything, the grains and the things that are going to cause these inflammatory responses? If we're working against inflammation, it's just grab the low-hanging fruit first.
Yeah.
And that's exactly, that's a great point of thinking about the nutrition thing. Thinking about all these subtle little parts that make up you. It doesn't just need to be, great, my back hurts, let's get an elbow in your T-spine. That's very direct. But there's a lot of different strings that we can pull, and nutrition's one of them. But I don't claim to be the man in nutrition. I just, eat raw, eat healthy, eat organic, eat food like that.
Yeah. And so you're seeing a lot of different patients. Just walk me through like the top 3 movement patterns that you are seeing that are dysfunctional. Sure. Right, whether it's excessive, flexion or weakness in the extension muscles, glutes, rhomboids, those things. What are those movement patterns that you are seeing that are dysfunctional? And then what are like the top 3 exercises you're using to help correct those movement patterns?
Yeah. Well, if you have one dysfunctional movement pattern in the body, then you have that dysfunctional movement pattern will end up spiraling through the rest of it. That's tensegrity, Buckminster Fuller 101, and that's like, so we could say, we'll just start at the feet and say collapsed arches or pronated feet, and from there you're going to have, and that's essentially like the duck feet walk thing, where you have, the navicular bone and all the architecture of the foot is just spoiled, collapsed on the floor. It's not sexy to look at, and so something from there you could say, okay, well, it's the pronated feet, or it's the valgus knees, because the knee is then going to drop in from there, right? Or you can go up to the chain goes all the way up. So we can just start with that, and with that, squats, deadlifts, really simple. If you can figure out, how do I screw my feet into the ground? So as you're standing in an upright position, I was standing on a foam roller there, I'll get off the foam roller. As you're standing with your feet on the ground there, just screw your feet into an externally rotated position. And what you'll see is the tent that is the architecture of your foot come up. It's beautiful. It's a beautiful thing. And then from there, it's practicing that movement. And as you're doing that, you're also getting that external rotation in the hip, which takes any slack out of the hip girdle. All right, so you're creating this maximal torque ability or power capacity in your body just by standing and engaging the glutes, screwing the feet in, going into that external rotated position, keeping your feet bent.
That's great. Would you mind just like giving us a quick demo of a squat and just walk us through all of the key movement steps or the key milestones in that squat?
Yeah.
That'd be great.
Yeah. So starting off, something you see this all around the world, people carrying, whatever it may be, a jug of water up on their head. Right? Yeah. So you can see that connection, and this is something I'll do with folks all the time, is just give them a little push down on their head or on their shoulders and see if you're able to feel that compression directly, poof, down to the feet, you're doing a great job. You're not metaphorically spilling energy all over the floor. Anytime that your hip is cockeyed or your spine's folded over or whatever it is, and you push down through that, if you break at that point, you are asking for injury and you're just dumping power that you could have had. So that's the first thing. Figure out, are you stacked all the way up?
Stacked, exactly.
And then from there, it's figuring, are you utilizing the strongest hinge in your whole entire body, being your hip hinge?
Yep.
Right? And so while maintaining that stack, people can do this right now at home. Just take your hands and put them right underneath those bony things in your pelvis called the anterior superior iliac spine, if you want to say that word.
ASIS.
Yeah, that one. Yeah, and so from there, just starting to hinge your butt back, and the kind of joking metaphor that I use that is, imagine you have probes on your butt cheeks, and they are exploring the world behind you.
I love it.
Right? So they're real curious about out the room behind you, and you are hinging back as you're doing this to make sure that you're adequately exploring with those butt probes. If your knees are going in front of your toes, when you look down, if you can't see your toes, you're screwing up. Your butt needs to go back more. You don't want to allow your knees to go forward in front of that. Unless you're dancing or doing something silly. If you're loading your body and you want the most functional, strongest squat you can do, knees got to stay back. And then from there, to activate the glutes and keep and clean up that knee stuff, clean up that foot stuff, there comes in the screwing the feet into the ground, right? So imagine keeping the feet pinned straight ahead and then pushing the knees out wide. Something you could do is get a band, put that band around your knees and try and break that band with your knees. And what you will feel is something maybe you haven't felt for a long, long time, is your glutes really engaging. And if you can really truly engage that hip hinge and that whole, all the musculature around the hip girdle, then you're starting to cook with fire, grease, or whatever that phrase is. Like you're finally starting to move well. But until you really start activating the full potential of that, you're probably going to get hurt, and you're not going to get close to what you could have out of your body. It's crucially important.
I love the example of the butt probes. Your butt's exploring. I love it. That's great. One of the biggest things when I was working with a lot of people on the physical rehab piece was they get in their squat position, like the, hip shoulder width, maybe toes 10, 15 degrees turned out. One of the key points was I always found that having just maybe a 5 or 10 degree bend in the knees allowed the hips to unlock, so you could so-called take those probes and explore a little bit and drive those hips backwards. I found that if those knees were locked, the first movement was a break in the knees, which is that not so good thing unless you're doing some dancing or something. And it basically froze up that hip joint from allowing it to kind of move backwards and explore, so to speak.
Yeah. Imagine that if you freeze one aspect of the body, everything else freezes, right? So if you stay loose and nimble on every joint or any joint, then all of a sudden the other joints start following suit. The same way that if you drop and pronate the foot, then the knee follows and the hip follows and the spine follows, et cetera, right? So it's just, it's a fractal image. Everything is relating to everything else, and it all comes back to tensegrity. It all comes back to, I have the little deal here, you can hear it.
Oh yeah.
Right? So if I push this little purple dot on the tensegrity model,
it affects everything.
Everything else has to
Everything
adjust
moves.
to that. And then the thing that we were talking about earlier, which might not be so valuable because it does kind of go out into a little bit more meta place, but I think that tensegrity goes into the way that we feel emotionally as well, because I think that our physical body is a representation of how we are feeling, and I don't think there is a separation between mind and body. But that's that's to each his own with that.
Well, I think everyone knows how good they feel after a workout. There's a reason why they feel that way. From a hormone perspective, from a neurotransmitter perspective, beta endorphin, it's a natural antidepressant. Also, just the fact that our brain is just like muscle, right? We need muscle, we need movement and resistance. Same with the calcium deposits in our bone. We need that force. Same thing with our brain, that sensory cortex where all information is interpreted in the motor cortex that goes out and talks to the muscles to elicit movement. We need stimulation. We need to do it. And that everyone knows they feel better after a good workout, right?
Yeah. And something that people can throw in, again, more like actionable tips that people can utilize is peripheral vision. Right now, are you staring at your cell phone, or, are you staring at whatever the heck it is, the red light in the road if you're in your car, like what's happening with that puppy walking beside you there? Can you can you get a peripheral vision of that? Can you try to take in the whole entire vision of the road in front of you? And what that's going to do is, again, it's going to relax your brain. You're starting to use different aspects as opposed to that just prefrontal analytical, frontal cortex business, which is important. That's why we have spaceships, but we can go beyond that and get into things, again, like dance, like music, like, sexuality. There's all these things that starts to get us into a broader usage of our bodies and our minds, but our culture doesn't praise that the way that some other cultures do. You go to some other cultures, spend some time in Senegal or West Africa, and drumming and dancing is a crucial part of the culture. It's not just a hobby pastime. It is a crucial part of the culture, right? And then there's a study I was reading recently in relation to which is like, drumming increases DHEA and decreases cortisol levels and increases natural killer cells and like all this stuff. You're like, yeah, of course. Right. Anything you shine your scientific flashlight on of health indicators, if you're doing something healthy like dancing or singing or playing sport or whatever it is, they're going to go up. And we have all these different ways of analyzing these things, and again, getting sometimes consumed in this analytical frontal cortex stuff. But I think if we can kind of let go of some of that, peel some of those layers back, and just get lost in the experience, that's what Steven Kotler calls flow, and like everyone else calls flow now. And that's one of the highest indicators of happiness in your life. How much flow did you have?
Right.
I think it's quite important.
Very cool. So went over some flow stuff. I like it. You went over the squat. I think you did a great job explaining that. What's that next movement? You said a deadlift. And we didn't actually touch upon the breath. So how important for you is the breath during the movement? I mean, some movements you may want to hold that breath and create intra-abdominal pressure to create more support. Some you may want to breathe through it and use the inspiration to help activate the thoracolumbar fascia to help pick you up and then bend you when you go into flexion. What's your philosophy on breath during movement?
It's great. So breath is your best tool, man. There's nothing that's gonna progress you faster than understanding how to wield your breath, and that's again something we're not educated on because our teachers don't understand it. Most teachers in school, it's not something we talk about in our culture. Again, so you come out kind of just like, you have all these amazing potential tools, and we just never get educated on how to use them. But there's something, for example, with like deadlifting or, say punching or kicking. There's one term you could call be the Valsalva maneuver, which is again creating that intra-abdominal pressure, right? So as you're going down to take that big lift, you're going to fill up your thoracic cavity and fill up your lungs and really take up all that space with your breath, and then hold that in as you're going through the most challenging portion of the lift. And what that's going to do is it's going to turn you into a little compression chamber, which doesn't leak power. Right? When we have loose, wobbly joints, you're dangerous. First of all, you need to learn how to drive your car. Right? If you don't understand how to drive this vehicle, you're dangerous for yourself and everyone around you. You know. But that's one of the big things is starting to flex that intra-abdominal pressure ability that we all have, and that's what that's just look up Valsalva maneuver and you can see millions of videos on YouTube exactly what that is, but you'll see that as well as you're throwing a punch, as you're throwing a kick, as you're swinging a bat at a baseball, anything that it is. Dr. Stuart McGill, great guy, he calls it the double pulse. Right? And so it's you make the initial, you turn your body into stone, he says, for the initial contraction, and then you loosen up for a second. Say you're going to throw a punch, you're planting, turn into stone, throw in the punch, turn into a whip for a second, and then upon contact, you're stone again. Right? And what that is the ability when you see someone, in martial arts, when you see somebody playing tennis, they're just creating that intra-abdominal pressure, which ends up strengthening their whole entire body. And then the opposite is true with relaxation. Right? And then
for everyone listening, what Aaron's talking about regarding the whole Valsalva, that's either you're taking in oxygen either through your nose or mouth, and you're either bracing the core or you're hollowing by sucking the belly button in. Do you have a preference to either one? Do you like the bracing where you're making the abs hard, or do you like the hollowing where you're bringing the belly button in and activating the TVA more?
No,
which is the transverse abdominis. That's like the natural weightlifting belt that we have around our tummy.
Yeah. I don't do any bringing of the belly button in so much unless I'm doing some type of yogic type activity.
So more bracing for you.
It's all bracing. Yeah.
Okay.
Because I want to turn into a catapult essentially. And so if whatever it is, if you're running, jumping, kicking, whatever it may be, I find it the most effective to be able to embrace the ability to open for a second, that whip position, and then brace and come in hard. And if you can have that combination, then you're really starting to be an effective mover, right? But with the hollowing and bringing the belly button in and activating the transverse abdominis and all that, I find that to be, I think that if you're really concentrating on activating your transverse abdominis, more than likely than not, you're probably missing it. Like transverse abdominis oftentimes and most always for sure is something that happens as a product of moving well. It doesn't happen as a product of searching for it and finding it. It's when you're able to do that dance move effectively, whatever it is, TVA is activating. I guarantee you. Anytime you're bracing effectively, it's activating. I guarantee it. But if you slow down and say, "Where are you, transverse abdominis?" It's weird.
Right. And there have been studies too where they hook up electrodes to the various back muscles and the core muscles, and they have someone, let's say, move their arm, but they figure out that the back stabilizers and the core stabilizers are activating about, I think, maybe 10 milliseconds before the actual core movement. So a lot of people, when they have dysfunction in the core, in the back, in the front of the abdomen, that timing is off, and then essentially you're like firing a cannon from a canoe, where you miss that stabilization, and then the movement, you're riding on ligaments and tendons versus musculature to support you.
So something that I think might be helpful to clear some things up with the core is, think of the core not as much of a place but an event. Right? So core is that sequencing, right? When Mike Tyson throws a punch, his core is coming from his fist down to his foot turning in, right? And so that connection, the electricity all the way through your body, through that airtight compressed system that now is turned into stone is on impact, that's core. Right? If we start thinking, breaking down, isolating core into leg raises and crunches and, you're reducing the whole down into parts. And when it comes down to be an athlete or, just a successful human being in general, if you're juggling, 450 parts of your body, it's too complicated. You're not going to be able to get it. So if you can come back and think, wow, I have one body. Right? My bicep brachialis is attached to the flexor digit, blah, blah, blah. As you're coming through that isolation, it's only textbooks that break that down. And a cadaver, when you cut away all the connective tissue and the white stuff, they used to call it packing peanuts. It's like, oh, let's get all the fascia out of here so we can really get into the meat, the muscle belly. It's like, no, that's not the way a living body works. But we've been duped. Because that's the textbooks that we study. We study dead bodies. We don't study living organisms, right? So breaking out of that dead body paradigm and dropping into what is full expressive movement as I'm just walking through the world. What muscle am I using right now as I'm talking to you? All of them.
Right.
But that's not as easy to break down in a textbook. That's the issue. Is we've gotten duped, I think.
Interesting. I think I see some of your Rolfing, your Thomas Myers type of philosophy coming in there with the whole connective tissue and your fascial planes.
Yeah, absolutely. And that's
very cool.
And that's by changing that perspective on the way that our bodies work in general, that will change your movement practice. If you believe that you are a broke down, Newtonian model of levers and pulleys, then that's probably how you'll exercise, because that's the most effective way to do it. But if all of a sudden you start thinking, oh, what about jumping? How do I jump really high and land really softly and really effectively? To do that, if you get wrapped up in the individual joints, and there have been studies in relation to this as well, that I think it was bicep curl, I think was what it was, and they had some EMGs connected up to the guy as he was doing the bicep curl, and fact check me on this, I'm pretty sure it was bicep. And what they found was they had one guy, they had them focus on the joint and focus on the muscle and really focus on just the parts that are happening. And then they had another guy say, just pull that son of a gun up there. Just get it, the weight from down low, get it up there. I want it up on your shoulder. And that's it. And what they found was the guy that just focused on the end game, focused on the result, not only was it easier, he was using it took him less electricity to make it happen, essentially, but he was stronger, right? And the other guy was flamed up, and he wasn't able to pick up as much weight. Right? So it's like, we're not built to juggle these parts. We're not. And now we're at this challenging point because we end up trusting the people that have the biggest polysyllabic words on how to break down. The people that, smoke and mirrors and blow us away with all of the anatomical structures that they break down, oftentimes they move like crap. And it's almost like a compensation in order to, instead of being able to really embody that movement, we talk about it.
Right.
And they're two different things.
And that's funny because when I went to school over at UMass Amherst, I was involved in a study, I think my sophomore or junior year. I was TAing for an A&P course. And one of the studies that was a very similar study that you were just talking about, I went to the lab and I took this huge needle. I didn't know what I was getting into. They gave me like $100 and I was like a poor college student. So I'm like, all right, sure. Yeah. So I take this huge needle and they get me into a bicep curl position, right? So they get me out like this and they take this needle and they just jam it right into my bicep. And I'm like, oh my God, where the hell is that thing going? It's going to hit bone. And they had me doing curls and they had the EMG going. And then they'd have me just think about doing curls. And they had me actually do the curls and then like whole isometric curls.
So that was you.
It may not have been that study, but I was involved in one of those studies. And it was really interesting. And they did it also too at this muscle right here. I forget exactly what this muscle is called, but it's right in this area here of the hand and the anatomical snuff box area. And they put a needle right in there as well. And they had me do these movements as well. Yeah, but it's very interesting. And I just thought I would connect that story there with your research.
No, absolutely. And there was a similar study with that, where working with the same thumb muscles, where they had visualization of movement as opposed to actually practicing the movement. And what they found was the same thing. By visualizing that movement, really communicating with your own muscular system, your own nervous system, by communicating with that, you are exercising it. And it's the recruitment of motor units that's the important thing, right? It's not so much just like hypertrophy or that we're just breaking the muscle down. It's what's the amplifier, the quality of the amplifier in your body, and that's something. This is like Central Governor and Tim Noakes. It's like getting into, we're only using a small percentage of our movement potential. That's why if a car falls on your baby, the little old lady or the mother's He-Man strength able to get the car off there. I've never seen that happen, but that's what they say. And it's like, that's what that is being able to tap into your own potential. Right. But we end up doing oftentimes is we just get wrapped up in like, I remember in high school, I was just sore all the time. I still go through phases of this where like gymnastic ring and stuff where it's just like soreness. That's just a part of life, right? You're just always sore, right? You should always be in kind of a state of breakdown. I don't agree with that. I think that we're able to kind of train ourselves to the point that we're not walking around like we have a stick in our butt the next day. That's really the magic point is working with our movement potential. What's our movement patterns like? Not just how badly did I break the tissue down and how big is it going to get tomorrow? Yeah. How much protein did I have? Right. This is a bigger picture.
Yeah, that's cool. Very cool. I wanted to touch back on one thing with the breathing, because there's a couple of interesting things. Like obviously we know like certain pressing movements, you may want to be breathing out through pure slips as you're pressing out in a bench press. Sure. But I've done some studies or some seminars with Paul Chak, and he found that overhead press, breathing in actually helped raise breathing in helped lower the diaphragm, which helped move the shoulder, the glenohumeral muscle better. So like during a military press, you want to breathe in during the press movement, out during the down, but it was the opposite for a bench press. It was more breathing out on the press and then in on the extension. Yeah. What was your opinion on that?
I would say play with it. That's the magic with breath and with your or nutrition or anything in general. Yeah. But I prefer the inverse of what I used to do, which was always that blowout, like you're saying. Yeah. And I personally literally never do bench press. Because it's not necessary.
Do you do more like a push-up instead, or
yes?
What are you doing?
Yeah. I do archer push-ups, and there's just all these names for things that it's like we love to attach to names, but movement. It's exploring your movement potential. So I'll go really wide and do like the Jack LaLanne push-ups, and then maybe bring an arm up 10 degrees and then up 30 degrees, and then maybe I'll lizard crawl on the ground a little bit, and then maybe I'll come over into like a side plank, then maybe a cartwheel or whatever, just exploring that movement. But something I do tinker with, I don't tinker with bench press because I don't think it's that necessary, because our culture is so front and dominant, right? So, and it's one of those things where it's like you want to go and exacerbate your pec major and minor and anterior delt and all this musculature it's already overwound up. So the necessity to spend your time investing in and contracting those tissues to a higher degree, I don't think it's necessary for me, so I end up playing more with pull motions in general with the gym.
Right.
But with that, with overhead presses, I find that to be incredibly valuable. And with that, I'm on board with what Czech is saying. Of really, it's all about the bracing. So if you can engage and fill up that thoracic cavity and then brace from there, it's a much stronger position, I found. But I would say explore. Have fun, play.
Very cool. And I think it's really important. Like when you look at movements, like I look at, all right, is it a push? Is it a pull? Right? Is it flexion? Is it extension? Hip? Or glute? Is there a rotation component? Is there a gait component or a spring component? I mean, if you really break down all movements, you can almost get them down to those 7 primal movement patterns, and then you can say, well, what's your goal? If your goal maybe is more aesthetics and you want more hypertrophy, then you can manipulate things and maybe do more bench press. If you want a balance of the two, you can do more of the functional things that you and I are doing in our program. So I like it. If you get the general philosophy, really you can just plug and play.
Yeah. And with any of those things, it's like, Ido Portal is really good with this. I kind of borrowed the dogmatic movement phrase from him. I really like it. It's the same thing with religion, same thing with nutrition, same thing with anything. You become consumed by this is the way that I'm supposed to move. And what I would recommend is with those dogmatic movement perspectives, I would say dig in, get all you can out of that, and then jump out of the box. Like enter the box, enter the temple, enter the church, enter whatever it may be, take the lessons that you can, find the treasure, and then leave and take that into the world. Let go of the rules. Oh, I did, 5 pushes today, so I should do 5 pulls to balance that. It's like, no, just feel it. But sometimes we're so kind of lost in what functional movement means in the first place. We need to have some type of grounded, codified movement practice. But then from there, I think you're really starting to cook once you start creating your own movement practice with those foundations of a good education on what it means to move well and move powerfully.
Got it. So on that note, why don't you walk us through the typical day in the gym? So you get into the gym, how does the structure and everything kind of come together to make a good workout for you?
Yeah. All right. Well, even more interesting, I just built a home gym at my house. And, so I have a gym membership because it's a big old room. It's got some other stuff. But I think it makes more sense for people to start to adjust the environment that they're in for, 18 hours a day. Yeah. And start thinking about if everyone had a pull-up bar, I think that's crucially important that you're able to get that overhead flexion. You can actually, again, change the architecture of that whole shoulder joint, the glenohumeral, that whole girdle by hanging in that position. Most of us end up being tucked forward and we come into that winging scapula position. So if you can just come up and start to integrate mid-trap and rhomboids and all that and really feel that, that's huge. Everybody should be hanging in their house multiple times a day. You're not going to hang too much, I promise. Right?
Love it.
And then from there, I have a barbell, with some Olympic weights, so I can deadlift that and I can snatch and clean. And I think Olympic lifts are super important for full body integration. If you're going to get into like one specific practice, and then I have a slack line in my backyard, right? So then I'll go from deadlifting, or snatching or whatever it is to jumping directly on my slack line. And then on the slack line, I'll come down, I'll do lunges on it, or I'll like balance on my knees, or just exploring different movements with that. Right? And then from there, maybe go for a sprint. And then from there, maybe practice whatever dance moves you got. If you play with capoeira or ballet or whatever it may be, do some kicks, do some punches, do some cartwheels, whatever you crawl on the ground. Right? And then getting more into your paradigm, get in the dirt and have a probiotic experience, right? Take your shoes off, right? There's so many shotgun approaches to this health quandary that we're missing out on because we're too myopic and we focus on dumbbell, get it to the shoulder. It's like, dude, you just spent 20 minutes reducing yourself down so that you move less effectively. Right? By getting, take your shoes off, roll around the dirt a little bit, jump on a slack line, climb a tree, all these things that this might be kind of out there for some people, they're really effective at integrating your whole system. And then not to mention you're looking out, you're instead of being in a small room in a gym like you are in the office all day, you're looking out over a horizon. Oh, that's good. Ciliary muscles in your eyes, right? Looking at your whole body as muscular potential. essentially.
I got your next niche for you, by the way.
Please.
Shirtless dance workout. Seriously, I think you will hit it. It will be an explosive niche, especially in the paleo community.
Yeah, I just finished a burlesque show. My first burlesque show. It was a paid burlesque show. I'm officially a professional burlesque dancer as of like 2 weeks ago.
Like I picture myself like sneaking and like, peeking through like your gym, and you're like doing the foxtrot without a partner. You're just kind of like, and you got the rose in your mouth and everything. Oh man,
10% of all proceeds go directly to you. No.
I love it. I love it. Very cool. Well, what else? Is there anything else here before we close up shop? Anything else you want to let the listeners know about yourself, or just anything take-home wise? One thing I see, you're doing a lot more with the bands too on your site, and I was just curious, how are you implementing the bands into your clinical practice, and how would people use them to kind of get an overall benefit?
Well, bands are great because they're decompressors. Right. So when an example of something I'm sure you've done or seen done, or something I do on a very regular basis, is decompress the shoulder joint, right? So that glenohumeral fossa there, the head of the humerus, sometimes is sitting on the edge of the precipice there, just waiting to dislocate, essentially. Right. So coming down, and I'll apply, as a person's lying down on their back, I'll apply a little bit of pressure with my hand or my elbow or what have you, right in that little pocket just medial of the head of the humerus there. Yeah. And then decompress that joint, bring that joint down into the table, which allows the scapula to start sitting on the rib cage and really being flat on the table or the ground, wherever you're at. And then I'll have the person go through a full range of motion, start raising their hand up in front of them into shoulder flexion, start coming up into abduction, or just rotate, abduction being like raising the hand up to the side, right? And so just exploring range of motion while we're decompressing that joint, asking it, Ida Rolf said, put the tissue where it belongs and call for movement, right? So putting that tissue in its most functional position, then move. And you're rewiring yourself. It's a beautiful thing to be a part of, right? And so instead of being dependent, giving somebody $150 to do that to your shoulder, you can just get a band, wrap that, in the self-care kit thing that I have on the website. I have a door anchor with it. And so you can adjust it at your house, blah, 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 and you can have it so that the band is coming out about shoulder level height, and then putting that around the shoulder, stepping forward into a little lunge position. It's pulling, decompressing the shoulder back, and then you move. Go explore full range of motion with your shoulder girdle in the most effective functional position.
That's great.
You can do it by yourself, and you can
do it with the hip joint too, right? So primarily you do it shoulder and hip primarily?
No, primarily I do it everywhere. So yeah, shoulder, I use it with the neck, I use it with the shoulder, I use it with organ manipulation or visceral manipulation. Oh, cool. Right? So I'll bring the band around my belly and my rib cage and such, and I'll start to bend laterally and over to the side and front and back, and I'll try and really start to disadhese all those connective tissues that are bound around my organs, right? This is again getting back into your department. Organ function is mental, emotional function. The vagus nerve, majority of those pathways are not coming from the brain down to the belly. It's going from the belly up to the brain, right? So if you have some dysfunction happening around the visceral tissue, I promise you're going to feel it in every other aspect of your life, emotionally, physically, et cetera, et cetera. So keeping those tissues lubricated, hydrated, moving, that is how we don't hang on to, SHIT. That's the thing. I get it. That makes a lot of sense. Yeah. And again, you're over at aligntherapy.com. You got some really good YouTube videos I see you always add to. I think you have some videos with the bands too, don't you? Yeah, of course.
And what's your YouTube channel?
What is
that? YouTube.com/AlignTherapy?
Align. Yeah, it's all links off the website. The handle for that I think it's Align Podcast, maybe. I'm not sure. Just go to aligntherapy.com, and then the handles for everything it's all linked off of there.
Got it. Yeah. If you're listening at home, lots of great YouTube videos. Also, your Align Therapy podcast, which is great. And then you got a lot of really cool stuff, like you mentioned, the self-care kit. And you also, I think, have a self-care, like autoresponder kind of series, right? When you have like a little ebook or e-video series. Yeah,
exactly. And we're presently working on a full A to Z, nuts to bolts, how to integrate functionality of movement into every aspect of your life. So getting into body, like the value of body language, and how to integrate functionality into how you, like I mentioned, chop your carrots and carry your baby, get in and out of your car. Every moment of your day is an opportunity, and we need to leverage that. Talking about like long levers, like that's the longest lever you got, I promise. starting to integrate that mindfulness and awareness of your movement practice into all the things that you do. And that will start to clear up so much that you may have not even realized. And the big thing is with anything, stick with it. You might not notice it today, but I promise you, the clients that I see 6 months from now, 1 year from now, 2 years from now, it's like, oh my God, what you've really changed.
Right.
What's going on? And it's like, well, just keeping at it. It's like, well, all right, keep that up. I don't know what you're doing now, but it's great.
Yeah, what's that expression? If you give me a lever long enough, you can move the world. Isn't that Archimedes?
I think that was Archimedes.
That's a great one.
Yeah, that's the big thing. Is really, Viktor Frankl is A Man's Search for Meaning. Everyone needs to read that immediately. It's one of the most important books ever, I think. And one of the quotes that he references in there quite a bit is Nietzsche's, "If you have a why, you can bear any how," I believe is how it goes. And that's the big thing. We're aimlessly moving through our movement practices with no understanding of why. If we can tap into that, what the heck is the point of any of this? How do I become excited and fascinated and really truly immersed in my physical experience? If you can get into that, oh man.
Right. It's like the average person that comes in and they have back pain. I mean, do they really just want to get their back pain, addressed? Right. Well, maybe they really just want to be able to go out in their backyard and play with their kids, and they can't do that. And that's the deeper meaning of why they're there, right?
Yeah.
And so you're trying to tap into that because that's the purpose. That's the big why that allows the how to work, essentially.
Bingo. That's it, man.
That's great. Yeah. Awesome. Well, I'm going to end with this here. You're on a desert island, right? You only can do one exercise and you can only bring one herb or supplement. What exercise and what supplement or herb?
One exercise, man, if I had to say one I would say capoeira, but that's a lot of exercise.
That's a lot.
So one exercise, I would say overhead squat. Overhead squat or hang. I think you got to have both, really.
Okay.
But so I would say overhead squat is a really important one because you clear up so much of that integration from your hand down to your feet. You're getting that thoracic extension, which almost nobody has. You're activating that hip hinge. You're opening up the knees. You're everything is getting. It's the most effective shotgun I think there is. And then you got to hang. You really got to. You got to hang. You got to climb trees. You got to pull around different ranges of motion. And then the one thing that I would bring, man, right now, as we're talking, I'm drinking some pu'er tea, which I really like. Last time I had a different response last time. Yeah, pu'er tea is really nice, man. And so there's some facts or whatever in relation to it. It's like makes your fat more bioavailable and helps with assimilation of adipose tissue and blah blah blah. That's how I drink. I drink because it makes me feel really good.
I love it.
Right now I'm loving pu'er. So I would say overhead squats and pu'er. I'll be good.
Pu'er tea and overhead squats, awesome. And I'm going to go do some hangs right after this podcast in tribute to you. Mm-hmm. And I may even do it with like an extra button undone on my shirt.
Yeah,
or what the hell? I may just take my shirt off altogether, just in tribute to you, Aaron. All right. Awesome, man. I appreciate your perspective. That's kind of extra meta, if you will, like looking at it from a deeper perspective. I mean, you take exercise and movement, and you really allow a different, deeper perspective. So I appreciate that.
I appreciate you appreciating it, man. I appreciate what you're doing as well, man. It's always great to get to chat with you.
Awesome, man. Thanks a lot. Give it a good one.
All right, see you, brother.
Thanks. Bye.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.